decreased to 158,437. So let's speak now to Dr. Farid Abdullah, who submitted that elections be postponed to a time in the future when there is demonstrable decrease of severe disease, hospital admissions and deaths as a result of high coverage of effective vaccinations. Dr. Abdullah is a director of Office of AIDS and TB Research at the South African Medical Research Council, on COVID clinician at the Steve Biko Hospital in Pretoria. He's one of those scientists who was consulted by the Moseneke Commission that was looking into whether or not free and fair elections can be held in South Africa in October, given the circumstances. A very good evening to you. Thank you so much for taking the time to speak to us, Dr. Abdullah.
Thank you, Sipi. So it's a weighty decision indeed for the justice to make about postponing the elections.
Talk to me about the variables that you had to consider. There's no doubt that thousands of lives would be at risk if South Africa sees large gatherings, several places across the country. But what scenarios or models did you have at your disposal for such an assessment?
So we looked at the first wave and the second wave, and as you know, we're in the middle of the third wave, and we projected that forward and showed that the fourth wave is certainly upon us. It's going to happen. I think there's common cause that it's going to happen. And also that this fourth wave is likely to start around October, but peak at the end of December or early January. The second thing we did was we looked at the interprovincial variation, and we drew the conclusion, which we think convinced Justice Moseneke, that provinces will be at different stages at different times. So whilst there might be some provinces that are in a trough where you think you could have an election, there'll be other provinces or municipalities which will be having a surge in infections. So there was no way to really find a safe, sweet spot, if you'd like, to be able to have an election. And we then proposed that only once we have vaccinated a sufficient number of people where we can see a decline in deaths, that it'll be safe to have the election.
So I'd like to hear from you later on what a sweet spot can be defined as, but just your submission, it contained analysis on South Africa's experience so far. What are the projections concerning a fourth and further waves, including the comment on our vaccination program as it continues? I think there's a sense of hope, or is it a false sense of hope, that because we're vaccinating, we might reach that sweet spot that you describe sooner rather than later?
So we will have a fourth wave and we will have a fifth wave, but the difference is that in our fourth wave or our fifth wave, what we'd like to see is the cases go up, but the deaths stay down. So if you look at the UK, for instance, that's a good model to follow, where they are having more than 50,000 cases a day at the moment, but the number of people hospitalized or dying are very low. And that's because they have a very high vaccination coverage. So that's where we want to get to. And what Justice Moseneke has done now is he's thrown down the gauntlet to the Department of Health, to all of us as medical staff, to vaccinate enough people in the next 4 to 5 months to be able to achieve that situation where even if we have a surge in infections, the number of people who will die will be low. So we want to see that divergence between the case-demic, the number of cases, and the mortality, and that will put us in a situation where we can return to normal.
I can tell you there's audible gasping in the studio when you talk about fourth and fifth waves, and some are saying even possibly sixth, you know, going on and on and on in terms of what could happen. But I'm curious as to Africa's experience as what has been happening in the north, even Asia. We've seen there's insufficient knowledge of the evolution of transmission trends, ineffectivity and the changing pathophysiology of COVID-19 disease that it causes. But I'm curious, you're saying we're borrowing from what we're seeing in other places, but what effectively does that mean, the future for modeling? There was a time when it was saying that Africa is having its own pandemic.
Yes, but just to finish on the last point, if we're able to vaccinate 200,000 or 300,000 people a day for the next 4 months, it will put us in a very strong position to really control the mortality. That's where we want to be. So let's all work together. Let's encourage the Department of Health to meet these targets. President Ramaphosa has a target of 300,000 vaccines a day. Let's aim for that this week or next week, and then we'll be in a position to have an election. If we aren't able to achieve that, I can assure you, Tsepiso, we'll be right back where we started in January or February, wondering about whether we should have that election or not. And coming to your question about the rest of the world, well, we've just seen a complete change in Asia, for instance. Indonesia has just gone through the roof. Thailand is following that trend. Now, Vietnam, for the first time, is having a surge in infections. So we're seeing quite a variation, across the globe of this growth of infections in areas which kind of always claim they'd be all right. Where we need to go is where the developed countries have gotten to, which is high levels of vaccination. So the US, UK, Germany, Israel, 4 or 5 countries have reached a stage where they're having an increase in cases, but the vaccinations are protecting people from dying. That's the only way forward, really, for us.
I need to ask about natural immunity and vaccination coverage. They are critical host factors, but while both these factors will contribute to the size and shape of the future spread, they have not been sufficiently enlightening for our third wave experience, have they?
I'm so glad you picked those words out of my report, Tsepiso. They've not been enlightening. So we don't really know to what extent natural immunity, meaning if you've had COVID before with the Delta variant or a previous variant, to what extent that offers you protection against a new variant. It definitely does offer some protection, some cross immunity, but we don't know exactly to what extent that's the case. We do know that in the case of vaccinations, all of the vaccines are not completely protective against mild disease. So we must all put our hopes in the fact that any vaccine, whatever the vaccine, is protecting against severe disease, and that's the medium-term goal globally. The long-term goal of trying to reduce mild infections, that's something that's, we still don't know enough about how that's going to pan out.
Thank you so much for speaking to us, Dr. Abdullah. There's so many questions I still have. Wish we had time, but thank you for taking the time anyway. Dr. Fareed Abdullah is a Director, Office of AIDS and TB Research at the South African Medical Research Council and COVID clinician at the Steve Biko Hospital in Pretoria. As the IC mulls over these recommendations of Justice Moseneke's report, which includes Dr. Abdullah's point of view and others, to postpone the October 27 polls, the Commission will be consulting with